A day after helping announce senators will work on health care next month rather than take a recess, Republican Senator Gardner spoke exclusively with our political specialist. And that conversation tops our news at noon. I'm Alan Janae. Haven't heard a lot from Senator Gardner on this, who has shied away from open forums on the issue as Republicans try to repeal and replace Obamacare. Well, political specialist Sean Boyd's covering Colorado first, and she joins us from our newsroom right now. And Sean, there is a whole lot of interest here in what he has to say.
You know, Alan, I asked Senator Gardner about the new health care bill Republicans are expected to release tomorrow. He indicated it will likely include one big change. It keeps the tax hikes on wealthier people the previous version eliminated. I also asked Gardner about critics who say he's ignoring Coloradans. He told me he's talked more than a dozen times, including a 30-minute call yesterday with these disability rights advocates who were arrested a couple weeks ago after camping out at his Denver office. And he says he and his healthcare policy staff have had nearly 400 meetings across the state, including one last week with the Democratic Socialists. One of the biggest criticisms of the Republican bill is that it will cause 22 million people to lose insurance, many of them included in the Obamacare Medicaid expansion. Gardner is part of the main working group on Medicaid reform and says his goal is to save Medicaid for those who need it most.
If we do nothing, if we let the status quo continue, then I'm worried that safety net, that important safety net, is going to be crowded out. It's going to be crowded out by other programs. It's going to be crowded out by a fight for scarce resources, tax dollars, and it's going to be crowded out by people who are newly eligible to Medicaid, able-bodied adults without children. That's something the expansion of under Obamacare created. And so I worry that those who truly need help the most are going to find it difficult to compete for the resources that they need. And that's why we have to make sure that Medicaid is sustainable.
Now, Gardner told me the bill does slow the growth of Medicaid, which means states will get less money than they expected. But he says they will also have more flexibility in how to spend it. And he says he's had conversations with both Governor Hickenlooper and Lieutenant Governor Donna Lynn about this. Both have been critics of the Republican plan. Coming up at 6, why he says he will not back down from reforming Obamacare.
Yeah, I know they're worried about Medicare. Sean, Medicaid, we're on storm watch right now for what could